Welcome to another episode of Resilient Women in Medicine. Today I'm joined by Beth Pedersen, MD. She is an orthopedic surgeon in Canada and is going to tell us about her experiences with her practice and her new focus on confidence in women physicians. Welcome, Beth.
Thank you, Beverly. I'm so happy to be here and I'm grateful that you invited me to participate. I just wanted to start by saying that the work you're doing is amazing. And really, as I've learned about resilience from you, it's opened my eye to the different facets of resilience. I always thought of it as simply recovering from adversity, but you changed my perspective on it when you started using words like reimagine, recreate, and reinvigorate your life. So I'm thrilled to talk about my experiences with you.
Fabulous, and those are great words to use to describe resilience. Let's hear about your experience as a woman in orthopedic surgery. That's generally a male-dominated field, and how that's colored your experiences.
You know, when I chose to go into orthopedics, I did it more because I really liked the medical discipline of orthopedics. I didn't think of it as a male-dominated field. And I have to say, I think I've been very lucky that most of the people that I've worked with and trained with were very welcoming to me. But as I've done some work around confidence recently, I've come to realize that confidence is portrayed differently in men and women. And so I am becoming a little bit more aware of the impact of it being a male-dominated field. Most of my career I have spent trying to acquire skills, and I've gained a lot of competence. The skills that I have is all around my competence. And I am much more competent as a surgeon over the last decade of my practice. And when COVID came to the OR and we were told that we needed to stop working, it gave me pause to think about what it would be like to have a hiatus, a forced hiatus from work in the operating room. And I started talking with a colleague of mine, Debrah Wirtzfeld, who's also a surgeon and a coach. And we were talking about how sometimes our male colleagues can just walk into a room and just carry on like everything's normal, whereas some of our female colleagues, I think, struggle with it a little bit more. And we talked about what that impact was. And we came to realize that in order to truly perform, to have what we call empowered performance, you need a combination of both competence, which is the skills that we have, and my competence is equal to most of my male colleagues, but also confidence.
So in your pursuit of competence, what did you end up doing in your career?
I went into the subspecialty of foot and ankle surgery, and then within that, I do pediatrics as well as adult. And then after I'd worked for a couple of years, I went and did another fellowship just to really improve my competence specifically around the pediatric foot and ankle.
And did you feel like as of going through those fellowships that it improved your confidence as well? Or is there something additional that you then did to gain that confidence?
When I was in New Zealand, I had the luxury of having worked as a staff person for a few years. And so I wasn't trying to acquire the content in the same way. And I could pay attention to how the surgeons I worked with interacted with their patients and their colleagues. And I became a lot more aware of the body language and the words that they used and how they said them, which has helped me with my confidence, because one of the aspects of confidence is the skills, which includes how you speak, the words you choose, and how you hold yourself and carry yourself.
So in your own practice, you've obviously become much more competent as well as confident. How are you bringing those kinds of skills to the physicians that you're working with?
Most professional women, whether it be surgeons, physicians, or lawyers, accountants, professional women in general, have a high level of competence. But a lot of us think that confidence is an innate skill. And I think it's probably similar to your work with resilience. I think a lot of people think some people are just resilient and others are not. Some people are just confident and others are not. but that's not actually the case. We can all take time to learn and acquire skills that will improve our confidence as much as we take time to learn and acquire new skills that are going to increase our competence.
So in your career, have you had personal experiences where you felt deficient in confidence and that you needed to improve that?
Absolutely. I think all of us have moments where we feel like we're deficient in confidence. And I think that confidence is something that is a little bit situation dependent, but once you have the skills, then you can recognize the times when you might feel like you're missing confidence and choose to act in a way that will help you later on feel more confident. So Debrah and I have come up with what we call a RISE framework for people to use when they have those moments where they feel like they're lacking confidence, but they can rise to the occasion despite their fears.
So overcoming fear, I think, is a much bigger issue in women than in men. And would you agree with that?
Yeah, I would. And I think that it's a complex question about the differences between men and women, because I think there are men who still struggle with some of the things like imposter syndrome that gets in the way with women. And so some of the feelings might be similar, but the actions that come out of that, I think, are very different between men and women.
And how about in your personal life? Have you had any issues where you've had to overcome the fear and improve the confidence?
I mean, I had a period of time where my husband was sick, and one of the things that I learned from that was to embrace community. I thought that I needed to do everything alone, and as I let my guard down and actually was willing to accept help in my personal life, it made everything easier. And I've come to realize how important that is in our professional lives too. I think in medicine, we're trained to be a silo, we're trained to be independent. And once we can start realizing that community and networking is important, it can really help enhance our career and also our wellness and resilience.
Anything else you want to add about resilience or competence or confidence?
Resilience and confidence are quite complementary, and I'm excited to learn more about resilience as you do this work, Beverly. And I think that as we work to be more confident, then our resilience will improve, but also as we work to be more resilient, our confidence will improve. So I think they go hand in hand very nicely, and I'm so appreciative of your work around resilience. As I became a coach and was able to reinvent myself that way, then I mitigated some of the stressors that I had, and I felt more resilient.
How are you balancing both the career and the coaching?
So and maybe this gets a little bit to your question about the male-dominated field. I think I had to let go of my expectation that I was going to work hours in the same way that my male colleagues do, because as a woman and as a mother, then I have the kids at home and I'm still trying to manage some of the household things in the way that a lot of my male colleagues are not. And I learned partway through my career that it was better for me to work a different pattern of hours, not necessarily less, but a different pattern of hours than my male colleagues do, and to create efficiencies that my male colleagues don't. And as I gave myself permission to find those areas, then it also created up time that I could use for coaching and doing some of these other things. Even though the typical surgeon mold is they're there from 7 in the morning until 5 at night, as a female or a woman surgeon, I am going to be there from 7 until the time my OR day finishes, leave, and then do paperwork at home after the kids go to bed. But it took a lot of confidence to be walking out of the hospital at 3 o'clock when all my male colleagues were still there in their office doing their paperwork. Like, I hadn't thought of it as resilience before, but I was able to recreate my work hours in a way that made it possible for me to feel like I was a good mother and also giving me time to do some of the stuff that I like to do outside of medicine, which is the coaching.
In the course that you're creating, is it both for men and women physicians, or is it for all comers?
We come from the world of medicine, and so our heart is with women physicians, but we've also found that as we've talked about it, there's other women that have shown interest in it. So we've made it open to any women professional.
And if people are interested in finding out more about your course, where would they go to look for that?
We have a website called www.empoweringwomenprofessionals.com. They can email me, Beth, at empoweringwomenprofessionals.com. And we have a LinkedIn page and a Facebook page as well.
That sounds great. Are you getting a lot of engagement so far?
We are. We're starting to have people who are finding the skills very helpful. We had a group that went through our course, and at the end of it, they were able to stand up and ask for things that are going to make their lives better. And so we came up with another rule that with our work, and that's called the law of confidence. L is for live, your A is for absolute, and W is worth. So live your absolute worth.
Love that. Thank you. And your work sounds amazing. And I hope that we'll be able to stay in touch and collaborate.
Yes, definitely. I look forward to our next conversation.